And this is now what we do with the primary care gambling service, of which Sharon, Emma and Annabelle are here. It's a new service, so it doesn't feel so new now. It started just before the pandemic, where we're trying to break down the boundaries that stop people getting into treatment, that stop the people that you see, that you know, that your loved ones getting to receive the effective care that they need. Through Beacon's help and through many other third sectors, we've managed now to reaching around about 1,000 people per year, and that includes affected others. We have no very, very few gates to our service. Basically, if somebody's an inpatient in a hospital, we might not be able to take them for treatment. But other than that, our doors are open. But the other thing we're trying to do is we're trying to reach the unmet need. We're trying to use the power of my profession, of GPs, and I know we're struggling at the moment, but you heard Neil's talk about all those times when people interact with those who might be having problems related to gambling, but don't ask, don't even know to ask. And though I'm trained in addiction, and I'm a psychiatrist as well as a GP, and I did specialist training in addiction, I never learnt anything about gambling, I promise you. So what we're trying to do is to spread the knowledge to my profession, who see around about 1.2 million people per day. And we're doing that through webinars, through training programs, through competency frameworks, and also, and Neil knows this, by putting a screening question on a digital consultation tool, so that we can hope to get people early enough that we can intervene. If you look at the literature, the prevalence varies from about 0.9 to about 17%, so that's nonsense to have a 34 times increase variability. And they've looked at the prevalence and they found it to be just under 10%. In other words, just under 10% of people out there have a problem related to gambling. And it isn't randomly distributed in the population, and you know that. It's much more likely to affect the young. It's much more likely to affect those from deprived communities, so probably out there it's much more than 10%. And it's much more likely to affect those from ethnic minority groups. It's hidden, and you know it's hidden. And the only way that we can make it less hidden is by, as Neil said, your help. GambleAware have also changed, or are asking for a change in how we send messages out. No longer around safer gambling, which has always, to my mind, felt a nonsense. How can you safer gamble if you've got serious problems with gambling? And their three messages are that gambling comes at a cost, which we know. Many of you in this room have borne that cost. Gambling can be addictive, which of course is barn door obvious to you, but not barn door obvious to people like my children or their friends. And gambling can grip anyone. Again, not so obvious to people in the larger community who think it's always the other person that has the problem. I know that Beacon should be leading the family approach to gambling-related harms. Neil mentioned that it can only be done with your help to try and improve the lives of those with gambling-related harm and to try and improve how we can get these people, all of them, into treatment so that their lives are not ruined